Distal femur fractures. Anatomy. The distal femur extends from the articular surface to 5 cm above the metaphyseal flare, constituting approximately 10 to 15 cm of the femur. Muller roll, square inter-epicondylar distance. Medial condyle, located more distally and is convex, contributing to the physiological valgus of the knee. Primarily concerned with the rotatory movement of the knee. Lateral condyle, mainly involved in weight transmission across the knee joint. Deforming muscle forces, effect on the distal fragment. Gastrocnemius, causes flexion. Quadriceps and hamstrings, lead to shortening of the fractured fragment. Classification. 1. AU classification. Type A, extra-articular. Type A1, simple, 2-part supracondylar fracture. Type A2, metaphyseal wedge fracture. Type A3, comminuted supracondylar fracture. Type B, unicondylar. Type B1, lateral condyle, sagittal fracture. Type B2, medial condyle, sagittal fracture. Type B3, coronal fracture. Type C, bicondylar. Type C1, non-comminuted supracondylar, T, or Y, fracture. Type C2, comminuted supracondylar fracture. Type C3, comminuted supracondylar and intercondylar fracture. Clinical presentation. Popliteal artery. Evaluate for injury, particularly in high-energy trauma. Saline load test. In cases of open wounds, 120 ml saline is injected intra-articularly to detect continuity with the wound. Imaging. X-ray. Initial assessment to evaluate fracture pattern. CT. Useful for assessing intra-articular extension of fractures. MRI. Recommended for evaluating ligamentous and meniscal injuries. Angiogram. Indicated in cases of knee dislocation or suspected vascular injury. Treatment. 1. Conservative management. Indications. Undisplaced or incomplete fractures. Impacted stable fractures in elderly patients. Methods. Hinged knee brace. Above knee cast, 6 to 12 weeks. Traction. Skin traction or skeletal traction with pins through the proximal tibia, applied in knee flexion. 2. Operative management. Cancellous lag screws. 6.5 mm partially threaded screws used for unicondylar fractures. Percutaneous, open fixation. Indications. Intra-articular fractures, non-union, and displaced fractures. Methods. 95 degrees fixed angle plates. Historical. DCS, dynamic condylar system, placed 2 cm from the articular surface. Blade plates. Historical, placed 1.5 cm from the articular surface, more difficult to apply. Condylar buttress plate, now largely obsolete. Lock plate, often used for more complex fractures. Osteoporosis. Retrograde intramedullary nail, IMN, used in specific fracture patterns where more rigid fixation is needed. External fixation, often used temporarily for unstable fractures or in polytrauma cases. Complications. Failed fixation can occur due to osteoporosis or poor bone quality, patient noncompliance with post-operative care, inadequate fixation technique leading to instability or non-union.